Alright, so for next up, we'll get to have an introduction. Now this will be our first video in the whole concept of what history taking and examination in obstetrics and gynecology. So we'll look at introduction to it. So for this one, let's look at it. Okay, so when you want to take history, history is I'm trying to ask the patient questions about how they feel. Then from there, I could actually get to have an idea of what is gone wrong with the patient, know about their main complaints and all of that. For examination is after the patient tells me what they feel like and all of that, I'm now going to now check the patient and find out things for myself. Okay, so trying to introduce you guys to this whole concept. History taking and physical examinations are actually very important aspects of this. Okay, so you are trying to identify normal changes. You are also trying to identify changes that are there because of disease. Okay, then you are trying to also make diagnosis. You are trying to manage. You are trying to also build rapport. You are trying to become a friend to the patient. Okay, so core principles is patient-centered approach. So ensure that the patient privacy is 100%. Ensure that the patient is confident in you and believe in you that their informations will not leak out. Use empathic communication and active listening. Obtain informed consent before any examination. So if you want to do anything to the patient, you always go in to inquire from them. Okay, so structured history taking. First of all, try to know the main reason why the patient actually came to the hospital. Okay, then in obstetric history, that's where you now try to know about their current pregnancies, their previous pregnancies, any complications that came up. In gynecological history, you're just trying to know about their menstrual cycle, mainly when did they start having menstruations. Okay, when did they start having menstruations. Okay, and how the menstruation usually lasts, how is the flow, and all of that. So medical history and surgical histories, chronic illnesses, past surgeries. You understand? You're trying to actually inquire about all of that. So drug history, you are trying to know about their current medications, the allergies and teratogenic, risk. Okay, family history, you are trying to know if there's any disease condition that actually run in the family. You understand? So you are trying to pick it up. So social history, you are looking at their lifestyles, their support systems, if they abuse drugs, and all of that. Okay, so for physical examination, you go from the general. Okay, you go to the obstetrics. Now you're trying to examine the pregnancy, how the baby's lying, the fundal height, the abdomen. Gynecological examination, you're just trying to look at their reproductive system, examine it to see if there's any issues. So clinical competence goes, so according to Ob-Gynec, differentiate normal from abnormal pregnancy changes, perform and interpret obstetrics assessments, integrate findings to your management plan, then communicate findings clearly, and try to explain things to the patient as best as you can. Okay, so that's it for this.